Deodorant, underwire bras, and soy, do they cause breast cancer? Many people ask that question. Dr. Jane Mendez explains what women need to know, including some common myths. Listen up. We have a list of some tips for breast cancer prevention. We mentioned a couple of them in the first part of the show, but limit alcohol, you said moderation?
Absolutely. And actually, there's some data to suggest that red wine contains phenolic acids, which can be protective against breast cancer. So red wine seems to be a winner when it comes to breast cancer prevention, but moderation is key.
Smoking, of course?
Yes, and obviously the number one killer of cancer in women is lung cancer. And those numbers have been increasing over time because of smoking habits in women. So certainly refrain from smoking is good not only for breast cancer prevention, but also lung cancer.
How does your weight contribute to possibly getting breast cancer?
Certainly, the more obese we are, the higher the estrogen levels because of the fat deposition and the estrogen levels are linked together.
Okay.
So maintaining a healthy weight is really important. There's some data to suggest that, we have to be active. We have to get our heart rate up. And it's not a matter of just going to the gym, but being smart, taking stairs, walking instead of just taking the stroller, just being active. And certainly, for some of the estrogen-sensitive breast cancers, breastfeeding is thought to be protective.
I was surprised to see that.
Yeah, it's not 100% absolute because certainly there's a lot of women who breastfeed who still develop breast cancer, but it's something that may be helpful in breast cancer reduction.
What about environmental pollution and certain chemicals? Is there a relationship between those two?
There has been a lot of data, yes, and especially insecticides and pollutants in the air, things that we don't think about. There's been a link with breast cancer. There's a lot of talk about water bottles and plastic and other cellular phones. Certainly just being cognizant of your environment, there's not 100% link between breast cancer, but we need to be aware of it.
We hear a lot about oral contraceptives and, because
Yes.
they're hormonal. Is there a link between those two? Because
Yes.
I hear a lot of women saying, I don't want to take it because I'm scared of getting breast cancer.
With the newer formulations that we have in this era, no. It used to be in the past, like the 80s and 90s, where they would have the formulations are very different than what we use now. There thought there was a link, but not at this point in time.
We hear a lot of misconceptions. I'm going to say a couple of them.
Many.
Oh my goodness. This one I think is funny, but maybe it's not funny, but I don't think it's true. Antiperspirant or deodorants can cause breast cancer?
Yes, there's been talk about that. There's some aluminum content in some antiperspirants which have been linked to breast cancer. That's a myth.
Okay.
Certainly use whichever deodorant you want.
Can you imagine if we weren't wearing deodorant?
I know.
Que peste.
I know. So it's a myth and there's no science behind it. Another one which is very common is your breast size. They say that the smaller your breast, the lower the likelihood of breast cancer. That's another myth. Your breast size has nothing to do with your risk of getting breast cancer. Another one that I'm sure you've heard about is the use of underwire bras.
Right, the underwires. Yes, I've heard of that.
Another myth. Though I have to say, underwire bras are a culprit for breast pain. And one of the most common procedures that I do in my clinic when the women come with breast pain is I take a look at their bra and I said, this is a culprit. And they complain of a lot of pain here in the lateral aspect. That's where the wire ends. And it puts a lot of pressure there. So I teach them to make a little cut and remove the wire, end of story.
There you go. Fantastic. Good little thing there. I like that. So here's another one that a lot of people worry about or they think, is there a link between consuming soy and breast cancer? Well, recent research says that soy does not increase breast cancer. In fact, it may even help prevent it. We have a short video to explain. Take a look at this.
Soybean, soy milk, edamame, and tofu. Does eating soy increase the risk of breast cancer?
No, in fact, eating soy is thought to be preventative of breast cancer, especially in young women.
Mayo Clinic dietitian Catherine Zaratsky says soy contains isoflavones, which are plant estrogens. Unlike human estrogens, which in high levels can increase the risk of breast cancer, plant estrogens do not.
Soy is part of a healthy diet, and so that women should not be fearful of of having edamame or tofu or other soy products in their diet.
The American Institute for Cancer Research recommends people consume 1 to 2 servings of soy a day.
And this is considered safe and healthy.
So go ahead, reach for some edamame or enjoy that cup of soy-rich soup. In moderation, soy is part of a balanced and nutritious diet.
All right, I have a couple more before we take a break. Sugar? Does sugar increase your breast cancer, your risk of breast cancer?
Sugar by itself, no. It's what sugar might do in terms of your overweight or estrogen levels, et cetera, but there's a lot of fats out there, special diets, and a lot of people talk about it, but eat in moderation.
And I think this is a big one because after the WHI, which came out years ago, hormone replacement therapy was just, woof, it went down quickly because of the results that came back. So your thoughts on that? Because a lot of women want to take the HRT, but they're scared of the breast cancer. I sold it for a while as a rep. I remember lowest dose, shortest duration of time, but still women are a little leery about it.
You know, but the surprising thing is that how many women are still on it and for many, many years despite all the new information. So I see myself having to ask women to stop them. And when I ask them why they're taking it, because my doctor recommended it. And I agree, who doesn't like to feel younger, have better skin, et cetera, as you get older. But indeed, chronic use is associated with the increase of breast cancer.
You know what great information. By the way, if you want to learn more myths and facts about breast cancer, head to our website, allhealthtv.com.